This video is analysis within the muscular system of the shoulder joint. So we're looking at what movements happen at the shoulder and what muscles cause that movement at the shoulder. This is the spec and actually shows that the shoulder has a lot of movements. Some you might have heard of before, some I suspect will be new to you. So this video might be slightly longer because of the nature of the shoulder joint. Remember, the shoulder joint's a ball and socket joint. The shape of those bones, the large round condyle and the fossa of the scapula, mean that it can do all sorts of movements. It's got the greatest range of movement. So let's work methodically through the movements and identify the agonist and antagonist muscles in these pairs of movements. First of all, let's look at shoulder extension and shoulder flexion. So if from the anatomical position you move your arm at your shoulder backwards, you're increasing the angle at that joint, which is extension, and that's what the movement looks like. So, and again, in the red, we've got the description of the movement. There is an increase in the angle between the humerus and the scapula, the bones that articulate at this joint. That is shoulder extension. And the muscle that causes that, the main muscle that causes that, is posterior deltoid. So over here, you can see that the deltoid muscle has three parts: the anterior, middle or medial, and posterior or back deltoid. And it's the posterior deltoid here that would pull your shoulder backwards for extension. And there's the agonist muscle. Conversely then, if you were stood in the neutral anatomical position and you moved your arm forward and upward, in this case she's put it above her head, but it doesn't have to be so high, you can see that the angle at that joint there is reduced. So flexion is always reduction of the angle at the joint. And you can describe it as being shoulder flexion is a decrease in the angle between the humerus and scapula. And the muscle that pulls the arm forward at the shoulder is anterior deltoid. I put a couple of muscles in there, they would probably help, so they might be synergists, but anterior posterior deltoid. So what we've got is a pair of movements, extension and flexion, and a pair of muscles, posterior and anterior deltoid. When generally speaking, not always, but generally speaking, muscles work in pairs. One pulls one way, one pulls the other way. There are exceptions to be aware of. There's a bigger version of the images just so you can see the muscles. Next pair of movements then, we've got neutral position, stood with our arms beside our body. If we move our arm at the shoulder up to the side, away from the midline, that's called abduction. So it's described up here. Away from the midline of the body is abduction. And the agonist that causes that movement is middle or medial deltoid. So the orange colour deltoid here. And you can see that's on the middle there. It pulls the arm out to the side. The partner muscle or the antagonist in abduction would be latissimus dorsi. You can see that muscle here. Latissimus dorsi is a big lower back muscle, but it interestingly attaches at the top or the proximal end of the humerus. So to pull your arm downwards towards your body, which is adduction, movement towards the midline, what happens is latissimus dorsi pulls on the humerus and pulls that humerus and your arm back towards your body. Again, there are exceptions. When latissimus dorsi is doing that pull action, what we want is the medial deltoid to be the antagonist and relax to allow that movement to happen. So we've got a pair of movements and we've got a pair of muscles. There they are again in larger diagrams. This is a tricky pair of movements to understand. So the shoulder, let me just go back actually, because what I should have specified is that this movement happens, flexion extension happens in the sagittal plane. I put it in the top right corner. All flexion and extension movements are in the sagittal plane. All abduction, adduction movements at the hip and the shoulder are in the frontal plane. So again, here are the larger images so you can have a closer look at these two pairs of muscles. Now this is a slightly tricky one. So we're looking at shoulder movement. If this athlete had raised their arm in front of their body, so it was horizontal to the ground. Then they moved it out towards the side, sort of parallel to the ground. That would be horizontal extension. It's also called horizontal abduction, which actually in my mind makes a little bit more sense. Abduction is movement away from the midline. In this case, the arm is horizontal to the ground, so horizontal abduction. Horizontal extension. Extension is increasing the angle at the joint, and again, that movement would do that too. So key is this is where the arm is horizontal to the ground or parallel to the ground. Horizontal extension or horizontal abduction. The muscle that causes that movement, the agonist, is trapezius. So this is trapezius, a big kite-shaped muscle, goes right up the back of your neck, right down to the bottom of your rib cage on your back. But you can just about see that the lines of this muscle are in different directions. If these horizontal ones here contract, then the limb is pulled backwards. So horizontal extension is caused by trapezius, the middle sort of strands of trapezius. The opposite movement is where the limb is moved horizontal to the ground, but towards the midline, or to reduce the angle at the shoulder joint. That would be horizontal adduction towards the midline, or horizontal flexion, reducing the angle, whilst the limb is parallel to the ground. And the agonist of that would be pectoralis major, pec major. You can see pectoralis major there, so it's the bigger of your chest muscles, and you can see that it attaches on the humerus bone, at the proximal end of the humerus bone here. So if this muscle contracts and these fibers pull, the humerus is pulled across the body. Here's the big picture so you can have a look. Now, the shoulder enables us to rotate the humerus. And I say the humerus on purpose rather than the arm. So this athlete happens to have a flexed elbow. So we're going to ignore everything below the elbow and below. It's irrelevant. They could have a straight arm. They could have a bent arm. It's irrelevant. What we're looking at is the specific movement that happens at the shoulder. So this athlete, because this is a ball and socket joint, basically you imagine there's a skewer going down through the humerus. The humerus bone can actually rotate around that skewer, around that axis. If the rotation, like this right-hand diagram, rotates away from the body's midline to the side, so they're spinning the humerus around in that joint, that's called lateral rotation or external rotation, moving towards the side. The agonist for that is infraspinatus and teres minor. Try maybe to learn one of them. So I would say maybe infraspinatus. So this is one of the, this is this muscle here actually. It's one of the rotator cuff muscles. So you can see it would pull and rotate this humerus bone laterally or externally towards the side. This is a posterior view looking backwards. So it would pull around to the side. If the humerus was twisted and rotated towards the midline medially, or internal rotation, then it would be caused by subscapularis, which is this muscle here. It's probably the better one to learn actually, subscapularis, but it would certainly be helped by pectoralis major. So I would recommend that you learn the name of infraspinatus for external rotation or lateral rotation at the shoulder, and subscapularis for medial rotation at the shoulder or internal rotation. So that's the tricky one to get your head around. You've kind of got to ignore the rest of the arm and just focus on this humerus bone spinning or twisting in that ball and socket joint. There's a bigger version of the muscles for you to have a look at. Then we've got shoulder circumduction. So this gets often confused with rotation. Rotation is literally a spinning movement. A bone spins around an axis. Circumduction is where the limb, or a bone if you like, but the limb makes a circular shape. Now what you'll notice, this is a bit like our bonfire night when you've got a sparkler and you make big circles with it with your arm. The point of attachment, so the proximal end of the humerus, remains obviously in the joint and fairly static, but the distal end of the bone or the limb makes a big circular shape. That is what circumduction is. So it's almost like making a cone-shaped movement with your limb. One end is pointy and stays still, the other end makes a big circular movement. You won't need to know explicit muscles that cause this, but just be mindful, all it really is a bit of flexion, a bit of abduction, a bit of extension, a bit of adduction, but in a smoother circular way. Because it kind of does those movements, it pretty much moves in both the sagittal and frontal plane. Probably a little bit in the transverse plane, there's probably a little bit of rotation, but mostly shoulder flexion and extension, shoulder abduction, adduction in those two planes. Now, let's move on to some that you may not have heard of before. So, if you pull your shoulders up towards your ears, you move them superiorly, so move them upwards. You can sometimes, you can just see it on here, these two bones here are your scapula. When you pull up your shoulders, you pull up your scapula too, of course. So this is a shoulder and scapular movement. Elevation is movement upwards at the shoulders. The upper fibers of trapezius will pull your shoulders up, pull your scapula up. Elevation is upward movement. Depression is the downward movement. So if you pull your shoulders back down as low as they can go, that is shoulder depression. And the agonist is the lower trapezius fibers. So the upper fibers pull up for elevation, the lower fibers of trapezius pull the shoulder blades and your shoulder downwards for depression. Again, it is mainly a scapular movement, but your shoulders move as well. Here are the images enlarged. Again, one you may not have heard of, so you could liken this to what you do when you row, when you reach out forward to pull on the oar. You actually have protraction of your scapula. So your scapula from the neutral position or move further apart from each other. As your arms move in a sort of rounded way, your scapula move around. One would move this way, one would move the other way. That's called protraction. And the agonist for that is pectoralis major. I'd be surprised if they ask you about the agonist for this or this comes up as a movement, but it is listed, protraction and retraction are listed, so we've got to be aware of that. The opposing movement then is retraction, when, as if you imagine you've got an orange between your shoulder blades at the back here, and you want to pull your shoulder blades back so much you squeeze that orange, squeeze the juice out of the orange. That is retraction of your scapula. And the agonists for that are the rhomboid muscles. So these are deep muscles. You'd have trapezius. Let me just go back. Trapezius is a superficial muscle. It's on the top, near the surface. Rhomboids are underneath trapezius. And there you can see are attached to your scapula. And you contract those and they pull the scapula back towards the midline. That is retraction. These movements, interestingly, are in the transverse plane because you can kind of see that they are, you imagine there's a vertical skewer, they're rotating around that skewer, around that axis. And they're your muscles.